So we wanted to talk to you today about children's mental health, obviously particularly pertinent at the moment, given the situation that we currently find ourselves in. We wanted to talk to you about some of the experiences of children during the last 6 to 8 months, and then also talk about some of the challenges that you have been facing as schools and how we think we may be able to support you going forward. And Dav is going to finish at the end with showcasing some of the freemium offer that Impero have to help to protect children's mental health and well-being. So before we start, I just wanted to talk a little bit about what mental health was and is. And this is a quote from Young Minds. You will all know that Young Minds is probably the leading mental health charity in the UK for children and young people. But essentially, the NHS talks about the fact that actually there is no health without good mental health. And over the last few years, there has been a real drive towards making sure that people talk about their mental health a bit more effectively and recognise the signs in themselves and indeed one another. Obviously, if you have a kind of pre-diagnosed mental health condition, that is slightly different to somebody who may have a kind of more temporary feeling of depression or loneliness. And some people's mental health or ill mental health is caused by things like trauma and pressures, or sometimes it can be caused by family history, it can be hereditary. But there's lots of ways that we can suffer with mental health, and it's important that we recognise that in ourselves and indeed in the young children and young people that we work with. As I mentioned, we are in a particularly challenging period at the moment, and I don't need to tell you that because you will all be living this daily. We did a round table last week with teachers at the Schools and Academies show where we were talking about some of the challenges that teachers face, and it was really quite emotional actually, talking to those teachers about both how they were feeling but also how the children were feeling. Some schools had lost staff members very early on. Some had a number of children whose parents had sadly passed away as a result of COVID. So it really is a very difficult time, not just for children and young people, but for staff members as well. Just I guess the backdrop to all of this is that every year NSPCC look at the kind of state of the nation in terms of some of the things that children are suffering from, and some of the more kind of extreme ends around suicides and children who are sexually abused, which can obviously cause quite severe mental health problems among children and young people. And you can see that some of the sad statistics around suicide, it's the second leading cause of death for ages ranging between 10 and 24-year-olds in the UK, US and globally. And 1 in 20 children have been sexually abused. So significant numbers of children being subjected to significant harm. Often children can be targeted for things like sexual abuse or extremism. So they can be groomed as a result of poor mental health, and particularly sometimes if they share online and especially online that they are having particular difficulties, that they're feeling low, that they're feeling depressed. Predators can jump on that and lead children down some very dark pathways which lead to some really severe causes of harm. So sometimes it's really quite challenging for children to share their issues and to share their concerns about how they're feeling about their own mental health, because it can lead them into significant cases. It can lead to significant cases of harm. As we've mentioned, there are many current challenges for children. And when we were doing the round table last week, we were talking about some of the misinformation and disinformation that exists in the online environment. And you will know that people like Facebook and Twitter have made direct attempts to try and stem the flow of harmful misinformation. I mean, in the last few weeks, we've seen issues around anti-vax and people already kind of trying to peddle out these stories around having the vaccination and the COVID vaccination and what it's going to do to us. And already that has led to children talking about the fact that, you know, they may not have the jab, and children being quite concerned about the things that they are reading. One of the issues that came up last week was the issue around the Welsh government saying that they were going to cancel exams, and the impact that that had on children in England, because suddenly they were worried about some of the sorts of whether they were going to have to do their exams or not. So it can be really challenging for children and young people, this disinformation and misinformation. Sadly as well, there's been an increase in the amount of child sexual abuse live streaming that's been happening over the last 6 months. And essentially, this is often described as non-contact abuse. So predators encouraging, coercing, blackmailing children into sharing images of themselves or abusing children and then live streaming that via the dark web mainly. And obviously, because predators haven't been able to access children in a way that they might do normally, they've converted this into the online space, which obviously has more than a significant effect on children's mental health and can cause children to feel suicidal. Last week was in anti-bullying week. We did a research survey, and we asked over 1,000 children about their experiences of bullying. The statistics were pretty consistent, again, sadly, with other reports. Around 22% of children said that they had suffered from bullying. But the shocking thing was that of that 22%, 44% of them said that they had experienced it in the last 6 months. So already quite strong indicators that children are suffering more from bullying through this COVID pandemic than they would do normally, and potentially the inference that some of the behaviours are being transferred from the offline environment into the online environment. Children feeling alone and lonely during this pandemic. I mean, you know, lots of children very, very relieved to get back to school, and particularly for those children who already have a pre-diagnosed mental health issue, they were feeling worse than they did do beforehand. So for some of them, they were feeling significantly worse. For others, actually, it was less stressful being at home because they didn't have to face crowds and do some of the things that they would normally do in a school context. So there's some interesting analysis about how some children feel compared to others. Children very scared about the impact of COVID. And I was just rereading some of the reports from the Children's Commissioner, and she was talking about the children who were most frightened were those children of key workers. So they were really scared about whether or not their parents were going to catch the virus, whether they were going to catch the virus, particularly at the start of lockdown. So lots of children feeling quite anxious about not just some of the things that are happening in the online environment, but the virus itself and the pandemic itself. Children going through additional trauma, vicarious trauma, because they're having to spend more time online, they're having to talk to people online, they may have suffered something happened to them online previously. So it's almost kind of re-traumatizing them, and talking to Childline about some of those experiences. This slide is from the Children's Commissioner, and it's quite interesting because it asked parents and children about their experiences of lockdown, and you can see there's quite a different analysis and perspective from children as opposed to parents. So when the parent was asked about their children, they all said that emotional difficulties, behavioural difficulties, and restlessness and attention difficulties had increased across the board. But for some of them, so you can see for the children, they thought there was no change. And actually for children with SEN and mental health difficulties, they reported that their emotional difficulties had actually decreased. And the theory around this is that it's because children were at home. So they were at home with their families, and in some ways they felt much more secure. So there's an interesting paradox around how different children were feeling during this period of lockdown. Again, more research from the Children's Commissioner, and they did a survey at the start of lockdown. So when we literally first went into lockdown, and then they did another one in June. And for most children, the levels of stress were relatively low, but it remained consistent. So around 22 to 24% of children were saying that they felt stressed quite a lot of the time. And for the children with the most stress in this survey were the ones whose parents had lost their jobs during that period. So the inference again is that lots of children were potentially hearing things from their parents that they perhaps wouldn't do normally in normal times because they were at home with them and all the families were together. So children feeling the kind of strain of that loss of kind of economic support if parents lost their jobs as well. And then what caused children to feel most stressed during lockdown? And you can see here, I mean, it's quite significant that the thing that was stressing children out the most was schoolwork. So that was the bit that they were having to kind of retain that level of schoolwork without the structure of school. So they found that really quite difficult. And for lots of teenagers in particular, they said, actually, this is really too much. There was a real split between boys and girls in relation to levels of stress and what was stressing them out. So the girls were saying things like the schoolwork and not knowing whether I'm going to be able to do my exams or not. That was the thing that was stressing them out most. Whereas the boys talked about not being able to play football and not being able to do physical exercise. They were getting very stressed out about that. And we know that stress has quite a significant impact on our mental health and how we feel. The other thing that was stressing them out was their friends. So normally, again, the theory around this is, and the theory is built around some of the narrative that children gave when they answered this questionnaire. The things that potentially they would have been able to sort out if they were going to school the next day, they weren't necessarily able to do that because they weren't seeing people in quite the same way. So that was quite challenging for them because they weren't, if there was a fallout while somebody was playing FIFA, for example, they weren't necessarily able to see them at school the next day and get things sorted out. And you can see there as well that my family life and my mental and my physical health was something that they were worried about. It's good to know that one of the things that they felt least stressed about was not having enough food, which is great because I don't know about you, but certainly my 14-year-old ate me out of house and home during lockdown. So there was lots of food flying around and children constantly eating snacks. I was wondering how he was going to get through the day without eating several snacks. But that's good. That's good that they're not stressed out about food. So this is a chance for me to kind of pause there It's a pretty bleak picture. It's really quite concerning, the impact of COVID in terms of children's mental health and how they're feeling and how stressful the last few months have been for them. But I just wanted to give you the opportunity really to share with us some of the challenges that you've seen and how it's affected children's mental health. So I don't know if people want to put things in the chat. I can't see the chat, so I'm relying on Jemima and Dav to tell me what you've put in there. If you want to put your comments in, that would be great.
So we have a question from Anna, or a trend that she's seen: significant increase in self-harm.
Yeah,
so there's some of the challenges. We've had adverse effects, especially since September. Our school has closed twice and the bubble itself 3 times. More prevalence of anxiety. Somebody else with anxiety as well. Anxiety is very popular, but a real issue. I'm just waiting for.
Are you seeing, just a question back to you, are you seeing these increased levels of anxiety in children that you wouldn't necessarily see those levels in normally? Is it a different set of children essentially?
Let's have a look. So we've got mental health increase. I've got a couple of other comments, Charlotte. Increased suicidal thoughts, isolation, self-harm, and higher anxieties for senior students. We've got students worried about being prepared for the next academic year and being able to meet the benchmark requirements for universities. Anxiety around parental jobs at home, so home situations. Yeah, it's on there. So we are touching on some of the challenges that we're seeing consistently across the country, maybe in different settings. Yep, so exams is on there as well as another one, some of the challenges.
Okay. Thank you for that. Sorry, Dav, go on.
No, family health seems to be quite prevalent on there as well, which again, we concur with. Family health is a real concern for a lot of students. And anxieties of parents being pushed down onto learners as well.
Yeah, that came out quite strongly last week when we did the roundtable on mental health. Lots of teachers concerned that parents were projecting anxieties and kind of oversharing with children about some of the things that they wouldn't normally. Very challenging. Okay, thank you for that. I'm going to carry on. So again, just to replay back to you really, that when Young Minds did a survey of teachers, and they did ask them about the impact of the lockdown and what teachers thought the impact was. And it probably won't be a surprise to you that lots of teachers say, well, 3/4 of them saying that it had the close down of schools had a negative impact. And obviously it wasn't a complete close down either. So many schools were taking very different approaches to how they delivered the curriculum and learning online. So some students got all of their learning online, some of them just got set work and expected to get on with it. So there's quite a bit of anxiety around people keeping up with things, and as some of you have mentioned, this anxiety about meeting the expectation to get into university and to make sure that you get the right kind of grades. And I think added to that is the fact that the 4 UK nations are all currently taking a slightly different approach, which is really difficult if you're a student in Wales as opposed to England, Northern Ireland and Scotland, and there really does need to be some consistency. Children and young people with a mental disorder were more likely to say that lockdown had made their life worse, and they were really quite challenging around their current situation. It was a very difficult time period for them. So as well as the students who might not normally have anxiety, you do have students who do have that kind of anxiety, and it's pre-diagnosed, finding it very difficult in this current environment. Again, from the Children's Commissioner, it's not easy to get treatment either, which is really difficult if you are faced with a child in school who needs urgent attention. The average wait is still 53 days for children to get a referral. That is obviously very significant. The government have already pledged that they want to expedite that, and they want to increase mental health funding, and indeed Young Minds do have a campaign to try and get this kind of early intervention and to get government to commit to spending in this area. We spend far more on adult mental health than we do children, less than half on children, and we know that if we can get these things early, it really does have an impact. So it's, you know, it's again a very challenging situation, and you know, notwithstanding that you may not necessarily have the opportunity to be able to direct people to certain sources of help and support. Okay, so what I wanted to do now is just again ask you a question about how you would normally identify any mental health concerns. So what would you normally do? How would that work? How would you identify it? Where would you record it? Who would communicate that? And again, if you could put that into the chat, and Dav will feed back and we'll have a discussion about that.
So we have change of behaviour, communicating with DSL.
Yep.
We've got, so talking to children or noticing changes in behaviour. This year we're doing more circle times in class, more opportunities given to the children to talk about issues. So a proactive approach to listening. There's quite a bit around behaviour and identifying changes in behaviour.
Yeah.
Reporting that back to a student services team.
Yeah.
There's some comments around attendance changes. It's interesting.
Yes. Yeah.
And challenging behaviour, which may be different.
Yeah. And just a question back, if you do notice these changes in behaviour, what kind of intervention do you put into place once you notice these challenges?
Okay. I've got teachers communicate with counsellors, and they're spending more time on the topic in the classroom.
Yeah.
Mental health first aid is quite popular. Recording everything onto one system.
Yeah.
Referral to behaviour support teams. Encouraging the learners to seek counsel, so school counsellors or specialist colleagues.
Great. Do many of you have school counsellors or counsellors in place? Just again, put your thumbs up. In-house counsellors.
So we've got pastoral advisors on site at colleges. We've got peer counselling, student services, and external agencies.
Okay.
So.
Okay, great. Okay, so in terms of how you would normally identify those issues, behaviour changes, any kind of challenging behaviour, anything that means that a child isn't behaving in a way that they would normally. How have you had to adapt your practice given that children weren't in school for six months? Was there anything that you did that helped you to identify any of those concerns?
So we've got some comments about working from home seeming to help contact learners and keeping an eye on them. So I'm quite interested to hear, I'd be interested, sorry, to hear on how that's worked for you, how you've done that. And again, lots of referrals to colleagues across the organisation.
Yeah.
So we've got a note here to say that Teams is being used, which is great. So it'd be great to hear about some of the technology that's been adopted. Checking in at the start of lessons, weekly one-to-ones as well with learners, individual ones.
Okay.
And group chats as well.
Group chats. Okay.
On
So
Teams.
you've had to, okay. So you've had to adapt your practice to try and identify some of these issues in a way that potentially you hadn't done previously, which is, again, it's great. I mean, I certainly heard of some teachers actually going and standing in, you know, next to a student's garden and looking over the fence to make sure they were okay because they were that worried about them. So lots of different approaches, and you know, I have to thank you all for what you do around making sure that our children are safe, because I think teachers have just gone above and beyond during this crisis to make sure that the children that they work with are as safe and secure as possible. I'm going to carry on. Just let's carry on. We've got another pause for some questions a bit later on, but thank you for that. Just, I guess this reflects what you've just said, really. But in terms of some of the normal ways that you might identify concerns, you might get a parent approach you about their child's behaviour at home, and they might come into school or email you directly to say that they're worried about their child's behaviour. You might get a child talking about a friend of theirs. So this particular incident is about a potential eating disorder issue. So you might hear, or somebody might overhear, a child talking about another child and the fact that they're, you know, that they want to increase their thigh gap, for example. You might have a change in grades or behaviour, as we've talked about. You might see things like a child throwing their lunch away, which somebody records. You might see some of their online behaviour reflected in some of the systems that you have. And essentially, all of these sources of information come together for you to be able to create a picture and a pattern around that child. Now, obviously, some of this jigsaw is not necessarily in place at the moment. So we wanted to try and support you in still being able to build up that jigsaw and build up that view around a child's life and some of the changes, whilst making sure that, whilst addressing this within this, in this current climate. It's really important that in terms of children's mental health and well-being, there is this whole school approach, and I'm sure that lots of you have been reflecting on how you manage this again in this current climate. You are not mandated to have a mental health policy, although some schools choose to, and certainly choose to have a separate policy to their safeguarding policy, for example. Some schools integrate that into their safeguarding and child protection policy, and particularly their behaviour policy as well. Some schools have put together things like code of conduct policies for children who are, especially those who are having their learning delivered remotely. So making sure that all of that is in place, and making sure that you really articulate to your students, your parents, and to one another how you're going to identify concerns and what interactions you are going to implement if you identify particular concerns about children and young people. The infrastructure and technology element can really help you, particularly in this new hybrid learning environment, to identify some of the risks that we've been talking about and to identify some of the trends and patterns. So having a system which not only monitors children's online behaviour in school, but also out of school, is really helpful, and it really helps you to see that pattern and to understand what's going on, both across the school but also individually. Obviously, you will need to make sure that you have agreements in place with parents and children, and to make sure that the devices are set up effectively, but it can really help you to identify and to prevent some of those issues. Your education and training, and some of you have been talking about things like circle time, about kicking off lessons, and everybody talking about how they're feeling initially before things get started. Obviously, the PSHE curriculum gives you the opportunity to explore some of these issues in more detail. And when in the Young Minds survey, teachers were asked about what sorts of changes they would like to see in relation to children's mental health. And the number one thing that they wanted to see was a change in resources and more money to help them to tackle some of the issues in schools, like so the fact that they could have school counsellors, they could have peer support networks, they could have mental health first aiders, which some of you have mentioned. But some of them were talking more radically than that. They were talking about overhauling the curriculum. So they were talking about this kind of focus being less on attainment and more on the hidden curriculum, and supporting young people to develop their skills and to develop their resilience. Lots of schools have a curriculum around resilience, so kind of building some of that resilience into children from very early on, from early years. So all of this is really designed to help to support children in that environment. And of course, staff as well. I mean, let's not forget staff in all of this, making sure that they're safe and well, making sure that their well-being is paramount as well, because you can't teach anybody if you don't feel safe yourself. So just making sure that there is that kind of whole school approach around education, both for students and for staff, and providing that training, and for the community as well. Again, lots of schools been doing some really proactive work with parents and carers around how they can support their children and young people through this pandemic. And all of this needs to be underpinned by, we've called it standards and inspection, but what we mean is essentially, how do you know that this approach is working? How are you going to assess that your children are feeling better? Are you going to survey them? Are you going to ask them questions? What is it that you're going to do? How are you going to measure what you're doing is effective? But this is very much a kind of a three-legged stool, and if one of these bits is missing, it will fall over. So important that you think about your policies, your practices, creating this culture in school, how the infrastructure and technology can support you identifying and providing those interventions, and how the education and training can both prevent issues but also manage incidents effectively. I'm going to just hand over to Dav now, because Dav's going to talk you through some of the challenges that you have, and also some of the potential solutions that Impero can help you with. Dav, do you want to?
Thank you, Charlotte. If you wouldn't mind driving for me, I'll just let you know when, and then I'll do a screen share. Hello again, everybody. So thank you so much, firstly, for sharing some of your feedback, which is really interesting for me in particular. The team that I work with, we speak to a number of different organisations across education that range from kind of your SEN, your PRU provision, your primary schools, secondary schools, multi-academy trusts, colleges, universities, local authorities, everybody involved in delivering education. And again, what that allows us to do is to have a real rounded view of the impact across education, particularly this year. One of the things that was really interesting for us at Impero is we were always looking at how we can shape our software that would better fit your needs going forward. And with the onset of the pandemic, it really made us turn this around super quick to make sure that whatever we did release was actually fit for purpose and it was going to work for you. Some of the things that we had to take into consideration, which I welcome your thoughts on as well as I go through, is we really started to have to look at hybrid learning environments. Now, what I mean by hybrid learning environments was very much where we had learners isolated at home, where we had the majority of the class in school. So we had to be able to provide solutions that would work across a number of different environments. We had to look at things like making sure that the software that we were providing in school would work on the devices the learners had access to at home, if indeed they had access at all. You know, it made us realise that there was quite a big divide and a lot of digital poverty that we had to try and support if we could. That led to us developing solutions that covered all different platforms, which would include things like your iPhone, things like iPads, Chromebooks, your Galaxy tablets, which would be Androids. So a whole cross section of devices that potentially we've never had to service before. We also had to look at scalability. So that meant that we had to provide solutions, for example, which could be procured en masse, deployed en masse. So if you were a local authority and you're responsible for providing online safety or safeguarding software, particularly for primary schools, for example, we had to make sure that the software could be serviced and delivered to several hundreds and thousands of learners. So we had to look at that. And again, with the changes in the quality of education, the way we're delivering education, the pedagogy journey, we had to make sure that the software we were providing, again, would service and work with the popular applications, but also support you with your change in learning styles. What we realised, I guess, across the board while we were on this journey in providing software is that our learners had to be front and centre of everything that we did. So we had to ensure that actually we're moving away from an ICT technical infrastructure where we're talking about devices and software, where we had to move to a learner-centric solution. Next slide, please. So this pictorial is basically just a really high-level overview of our solutions and the journey that we're on as an organisation. Some of you will know us, some of you will know us as providing your online safety software or your classroom management software, or maybe the software the school uses to manage the actual kit in the classroom. So we call that device management. We then had to look at the learner wellbeing piece as well and how we would bring these two elements together. We did decide that we needed to look at a freemium. We needed to look at a solution which could be accessed by anyone at any time, with the fundamental reason of being learner well-being and student safety. And it had to be accessible and it had to be easy to use, which led to the development of Backdrop, which forms the foundation of our other modules, which are paid for modules. But today's session being on safeguarding, I really want to focus on that element, which is completely free. Next slide, please. Thank you. So when we launched our freemium solution, I wanted to put this slide in here just to give you a bit of a visual representation on concerns. Those of you that work in safeguarding will be familiar with the term concerns, which can be raised for any number of reasons. They can be offline concerns, child protection, behaviour, can be attendance, it can be well-being, it can be any number of things. And then there's online concerns as well. So anything a learner is looking at, maybe searching for as well, that's also a concern. Our safeguarding software allows the organisation to bring together online and offline concerns in a single central platform called Backdrop. Now, since we launched Backdrop, the freemium elements alone, if you have a look at this visual representation from April, from onset, we found the concerns that were being logged in the system seemed to be fairly consistent. They were growing with the usage of the technology growing. Then we had summer holidays, and then we realised a significant peak in activity in use of our safeguarding software. Now, obviously, this is only a snapshot, but this was telling us that when the learners returned to school, there was a huge spike in online safety concerns and safeguarding concerns, full stop. It would have been potentially the first time you would have seen the learners since March. I mean, certainly from some of the feedback that we had from the schools we were working with, they were talking to us and telling us that usually they'd have visual contact with the learners, and they weren't able to have visual contact for some time. So as soon as they could, they really needed to flag concerns. They told us that they were often using paper-based systems, and those systems were left in school and they had to go home. So they no longer could access the records for these learners. They were talking to us and telling us that it was really difficult for them to share information, particularly between colleagues and also different sites and different locations. I mean, even down to concerns around GDPR. you know, some of the schools we work with were telling us that they were afraid almost to log information because they were worried about GDPR compliance or issues around that. So I'm just going to give you in this slide a really high level overview of some of the capability of the software. I would like to do a screen share with everybody as well, just to show you where to find this information. So I'm going to let you have a quick read of the slide, because I'm actually going to show you the software, because I think it'd be really easy to show you where you can find it. Backdrop itself, it's a URL that you would go to, and from that URL you will be able to access a digital safeguarding solution, which would be almost a replacement for some of the solutions you may be paying for in school already, or potentially provide you with the option to introduce one into school where you might have paper-based records. So if we just go on to the next slide. Thank you. So there's two elements in Backdrop. We have a digital safeguarding portal, and we also have wellbeing, which is screenshots and captures. So I think if we go to our website first and foremost, I'm going to talk to you about Backdrop, as we've mentioned, our free digital safeguarding solution. So I'm just going to guide you to where you can go for additional information. So this is where most of you will think, oh, she's trying to plug her software. This is the freemium. So again, I'm going to reiterate, there's no cost to this. You can download this, you can get started, you can upload information on your learners, and you can start recording concerns immediately. So I just want to show you where you can find that. So if you go to imperialsoftware.com and have a look under products, go to Backdrop. I'm just in the Backdrop platform at the moment. And again, this is our free area where you would go in and you can literally go in and create a concern about any learner in your school at the moment. Now I can hear some of you thinking, well, how do we get our learner information in there? How easy is this? This is as simple as a CSV upload of learner data. It's also very, very easy to set up a link to your MIS. So what we do here is we sync with we have about 55 MISs that we work with. That sync allows us to pull through all of your learner data into a single central record. So if I just go back, I've got a quick link set up for one of my learners, Lisa. I'm just going to click into Lisa, and here a lot of the information related to Lisa's information is actually coming through from the MIS, but we can add this, as we say, with a CSV file upload. And this information that we're containing in here gives us a high level overview of some of the safeguarding information we may need to view for that particular learner. We can also view from here a chronology, any other concerns that have been raised by any other colleagues across the organisation that may have spotted something of concern and would like to share that with other colleagues. If I just go in and add a concern for you, just to show you how straightforward and easy that is, we have the type set out for you, which would be an out of the box setup, but you can certainly change these for you. We have the ability for you to define who's raised the concern. Often what we did find is concerns are raised, but we need to record who's bringing them. So if I'm raising a concern, often that concern could come to me by a third party. I'm keen to know if that happens in your school as well. If you do often, if you're told things that you need to record in a central system or a central place on behalf of others. So here you get a date, stamp and time of when that happened, and the information you're recording can be court safe and used as evidence. So here I'm just going to go through some of the actions. Here we can write verbatim all of the information related to the concern. We can add any files, whether we've got any photographs or anything that we need as evidence. We can do simple things like we can record locations. Often when we're recording things about a slip, trip or fall, we might want to record where that's happened. Where this has been really powerful is if we were having continuous falls in a particular area in school. By having something like this in a single central place, we can spot trends. We can pull reports that show us where these things happen. We can put in the relevant interventions. And again, I have a process flow here, which is, have I spoken to Lisa? I'm going to record the conversation. And do I need to notify the parents, potentially by telephone? The information comes through from the MIS on parent information. And I'm also able to fill out things like a body map if we're recording additional information of any injuries, etc. And lastly, very easily, I can alert users en masse individually, and I can send emails as well. And this is all, again, just to reiterate, the free system. We also have in the system the ability to record meetings against that particular learner. We also have the ability to record medications. Now, why I particularly like this as a parent myself is I often have to sign a paper-based form when I take in medication. But what I really like in here is if it's a repeat medication, we can have online electronic forms. So this really helps the organisation stay compliant with GDPR as well, and have locked records in school of parental permission, any signed documentation as well. So here we can put in medication, the type of medication it is, dosage information, you know, whether it's been administered or not, when it needs to be administered, and more importantly, expiry dates. Here, things like inhalers, we have this issue where they may be out of date or they're under lock and key, and when we need them, they may have been past expiry. I don't know if anyone's ever experienced that, but that seems to be something that does come up sometimes for us. So we have all of that, again, in the free system. We have also a document vault in here. This is where a number of our schools that had been using paper-based systems actually have uploaded records that they have on file, and therefore they were able to shred and destroy that evidence. It's all been uploaded electronically and digitally in a single central record. We talked very much about the freemium solution, which is Backdrop. I'm just going to show you how you would create a concern from this window also. Now, my system pulls through learner information in class groups. It's because I have a sync with my MIS. So my information comes through as tutor groups. So I can see this is my form group. I have the form group pinned. I can see who's part of the form group as well. And I can go in and do a number of things from a teaching perspective here as well. So here we have avatars of my learners, and I can go in into each individual learner, and it takes me back to the same screen as before. So I've got multiple ways in which I can record information. I'm just going to jump in now very quickly to wellbeing. Now, wellbeing is the paid for element of the software. So you have digital safeguarding, absolutely free, where you would record concerns. And what we have here is your online safety captures called wellbeing. In here, the system will record anything of concern that's automated and triggered by keyword strokes, which are then picked up by lists of keywords, or what we call policies. Now, being in the industry for at least 18 years, we've probably got about 26,000, if not more, words, context, phrases, all related to different policies. They will range from prevent radicalization, mental health, well-being, FGM, there's all sorts in there. So if I just select one as an example here, just to talk you through a screenshot, this is just a trigger. We called it the word elephant from list 1. Now these lists, we give you out of the box lists, which we feel are industry standard, but the software also gives you the ability to add your own. When we've been working with some of our multi-academy trusts in particular, and they talk to us about county lines, or they talk to us about gangs that are prevalent in their locations, they want to be able to add specific terms and search for those specific terms and capture. This system will allow you to do that. Once you have a trigger, such as this example, you can then immediately you can triage this, you can give it a severity level. The system will pull one through for you, but you can certainly change that. You can flag it as a false positive, and you can also raise that as a concern immediately in the same software, in the same record. But what we have here is automatically the screenshots are captured and pushed through to the record of that learner. And then when we go into the learner, for example, we will be able to see all other concerns related to offline activity as well.
Thank you so much for that. And I hope that everybody can see how the system can help you to track trends, to identify risks, to be able to provide you with that early intervention that all students need, especially at the moment. And as Dav has said, the system Backdrop is a freemium service that I think is really useful, especially in this kind of hybrid learning environment. If you do have any questions, and Jemima, correct me if I'm wrong, if you wanted to write them in the chat, and then we can respond to you afterwards. As Dav said, if you want to find out more about the backdrop system, go to impero.com. Is that right, Dav?
Yeah, absolutely.
Yeah.
I was going to say, so we can keep the chat open if you want
Yeah.
to drop some feedback in there, and we can send out a follow-up email with a link to the presentation. We're always happy to hear from you, and if anyone would like to find out a little bit more, we can put the notes on there for you. But really hope you found it useful, particularly Charlotte. Thank you very much for the overview as well on how it's looking across the UK.
Thank you very much. Thanks, Dav. And thank you to you all. Like Dav says, if you have any questions, please do come back to us. If you've got any specific questions about safeguarding as well, then please do put that in the chat as well, because Jemima can direct them to me as well. But thank you very much. Enjoy your evening. Enjoy the weekend when it comes. Thank you, everyone.